To demystify a little bit when you undergo anesthesia and fall asleep for a surgery. I want to just kind of step through the medications that we give and the process for you to go to fall asleep. Keep in mind, this can vary greatly. There's many ways to do anesthesiology, but what I'm about to tell you is what most of the medical world does in the United States and likely Europe and Canada and elsewhere as well. When you come back to the operating room, we put on monitors, we put a mask over your mouth and nose. That's usually just oxygen going through that mask. It's usually not a gas. We usually start the gas not until after you're asleep. Again, that can change. Sometimes people will start nitrous oxide, but it's usually just oxygen. And you're not breathing in the gas, and that's not how you're falling asleep. We usually have you fall asleep with medications through your IV. And the medications that we give are typically in this order. We usually give IV lidocaine. Lidocaine can help numb the IV to help prevent the sting of propofol, which we give later. Lidocaine can also blunt your fight or flight response a little bit, and it can help it so you don't respond so much for when we put in a breathing tube when you're asleep. We also give fentanyl typically, which is an opiate, and we usually give that to you while you're still awake, so you may feel that as you're drifting out to sleep. The point of giving fentanyl is to also blunt your fight or flight response, so your heart rate and your blood pressure don't go through the roof when we put in a breathing tube. Then typically we'll give propofol. Yes, it's the medication that killed Michael Jackson. Yes, it was a crime, and yes, that physician is in jail for misusing that medication. Propofol is used widely. It's white. It's like milky white medication. And when we give it, it can sometimes have a stinging sensation in the IV. That's what the lidocaine does. It can help, sometimes it can help numb the IV. You might feel a burn in your arm from it. You might not. It's random. The propofol will 100% turn off your brain. It will do this for every single person it's given to. And what we do is we titrate to effect. We give enough. We see if you're asleep. We give some more. See if you're asleep. You will fall asleep with this medication. It's guaranteed. After you're asleep, then we give a paralytic. We paralyze your body. It's usually something like succinylcholine, rocuronium, vecuronium, cisatracurium. They paralyze your body. We don't paralyze your body when you're awake. We wait till you're asleep because we don't want you to feel like you are that you're in the grave of your own body. Once the paralytic is in, that opens up your breathing cords. It makes your body nice and still, and we can put it in the breathing tube without your body's reflexes responding to us. Then we usually turn on an anesthetic gas through the breathing tube, and that's what keeps you asleep the whole time. Again, I want to emphasize, this is just one way of doing things. It's very standard. There are many, many variations of doing an anesthetic like this.